Hello, I'm Dr. Leibovitz, your Central Indiana go-to foot doc. In this episode, in this video, we're going to talk about FAQs, foot and ankle questions. In the previous video, we talked about the causes of bunions. Now we're going to talk about how to treat bunions. So our first question is, how do you treat bunions and what can you do for bunions? Well, understanding that a bunion is a bony deformity. So there's two options. Either we protect it or we correct it. We try to change the environment around the joint, around the big toe joint, so there's more room. So we take a shoe that's softer, wider, taller, an open-toed shoe or a sandal to make more room for it. And typically shoes are made for normal feet, so they're not going to tolerate too much of a deformity before they irritate the foot. So as Spider-Man says, with great deformity comes great shoes. Now shoes can help, but they can also create an acceleration of the deformity. They won't create a cause, but they can make it go faster. So an aggressive dress shoe that pushes that toe over is not going to be really helpful. Okay, do bunion correctors work? These are those things you see in the back of magazines. They're these straps, flaps, kind of Velcro type of gizmos that will hold the toe over, and they'll promise you that they'll do a correction. They're going to make somebody very happy that you bought them. It's just not going to be you. They may work where you put them on and hold them in position, but as soon as you take them off, we're going to get a reoccurrence. Remember, this is a bony deformity. So there's other things that we see in the back of magazines. There's creams, lotions, pills, medication. If they do provide some relief, it's usually for treating the inflammation, not so much the cause. So if I had a hammer, I kept repetitively hitting my hand with the hammer, what type of cream can I rub on it to make it better? Well, how about we just put that hammer away and stop that repetitive trauma? Okay, next question. How do you get rid of bunions and how do you fix a bunion? Well, now we have to address the deformity, and that involves correction. And there's multiple different surgeries, procedures that are made for bunions. And the key with choosing the right one is to make sure that it's durable, that you have good results right after the surgery, a year after surgery, 10 or 15 years after the surgery. The longer the deformity there, the more aggressive it gets, which requires more aggressive correction. So keep that in mind. Let's take a look at a blueprint of a bunion, and that's an x-ray. What we're looking at is three different areas. There's the first area, which is the separation between the first and second metatarsal. As the more of the first metatarsal migrates away, the larger that becomes. The important one, the key, is the second area. Those two arrows are pointing to two circular bones called sesamoids. They act as pedestals, and they should have the metatarsal sit right on top of them. And again, the more the metatarsal migrates out and tilts away, the further they become, which then makes area number 3 look larger. That's not a large bone, but a bone that's been tilted and displaced. So looking at those same three areas on a corrected foot, we notice that that first area is much narrower, and as that first metatarsal again is placed in a better position closer to the second metatarsal, we see those sesamoid areas, those two little headlights now are right underneath the first metatarsal where they belong. And as that first metatarsal drifts over, we see that area number 3 virtually disappear because it seeks a better position. Now what I'm looking for in a bunion correction, I want to see really good sesamoid position, I want to see it right underneath the metatarsal, I want to see good range of motion, 40 or 50 degrees, and I want to see no restrictions of shoe selection or activity. Okay, more questions. Should I get my bunion fixed, and when should I fix my bunions? Well, those are semi-rhetorical questions because there's not one answer for everybody. I've seen the most aggressive deformities where the foot's pointing north and the big toe's pointing east cause no problems because the activity level's been very low. I've seen some moderate deformities create excessive limitations because of the significant irritation. So when you come to me and we talk about bunions, you may be a little disappointed because I'm not going to tell you to have surgery or not have surgery or when to have surgery, but I'm going to tell you and give you the information so you can make a good decision depending on your needs. Primarily we're looking at decision making of pain, the level of pain and restrictions of activity. And there's a third option. At one point it was never a big deal. I never had insurance related to having a surgery, but with high deductibles of $2,000, $3,000, $5,000, $10,000, if that's met, it makes that decision a lot easier for having those type of symptoms. Okay. I guess my concern too is, I should say when not to have surgery. If you don't have a good family support team for the first 2 weeks, that's going to be pretty important. If you don't have the time for the full recovery, if you think you can push it a little bit sooner, there's a return to work or wedding that's specifically at a given time and you're right at that end point, that may be a problem if it goes a little bit longer. You can't push this sooner than the listed time. You may have a failure of surgery or may require more surgery. If your health is not real good, don't have the surgery. We could put you at risk. And any type of nicotine exposure, not a good idea. I don't do elective surgery on people using nicotine. So how painful is a bunion correction? Well, we have to look at how painful it is beforehand. And after the surgery, the first 3 or 4 days are probably the most critical. And if we control swelling, we have about an 80% reduction of typical irritation and pain. And that's done very simply with elevation, having that foot above the heart. So now gravity's working for us, is pulling any type of fluid away towards the body, and ice. We use a special machine that circulates cool water around the extremity. Not only does it lower the temperature, it decreases swelling and provides an amazing amount of comfort. The earlier we get control of swelling, the earlier we can get range of motion, which means a faster recovery time. So tips. If you're doing a lot of walking, a lot of steps, and you're getting kind of bored, check out your local animal shelter or rescue. They may have a dog you can walk, or if you have a neighbor that has a pudgy pup, take them out and you'll get 2 birds with 1 stone. You'll get a companion to do some walking. So if you have any other questions about foot and ankle, send them to me, both through my website or through Twitter or Facebook. I hope you learned a little bit more about bunions and didn't bore you too much. I'm Dr. Leibovitz, your Central Indiana go-to foot doc.